In this video, we're going to talk about pH balance, which is the secret to digestion and overall health and well-being. If you're new to my channel, welcome. My name is Dr. Erica Steele. I'm a board-certified naturopathic doctor. I hold 7 degrees in my field, all in the natural healthcare space. We're in week 4 of Intro to Holistic Medicine. If you'd like to join our self-paced course, you can jump in at any time by clicking the link in the bio and scrolling down, registering right there through the form. Also, we have tons of other classes available during the week, including my morning flow class, which is at 6 a.m. Eastern Standard Time. If you miss a class, no big deal. There are replays available. Sometimes even I will take a break, so there are replays available for that. Our live class for Intro to Holistic Medicine is filmed 7 p.m. Eastern Standard Time on Wednesday and 11 a.m. Eastern Standard Time on Saturday. So if you want to check out the live class, if you're registered for the course, you will get access to the replays. Otherwise, they won't be available. So make sure you register if you're interested. This week, I'll be on 100 Pax's panel Wednesday at 12 p.m. Eastern Standard Time, talking about my favorite topic, holistic health, and teaching people on that panel. So definitely check it out. My weekly Lunch and Learn webinar is on stress management this week. And so that'll be held on Thursday at 12 p.m. normal time. All right, so let's talk about how your body regulates your pH using a buffering system. So a buffering system, as we've talked about last week, it helps keep everything balanced. And so it keeps things neither too acidic or neither too alkaline. The stomach pH needs to be around 1.5 to 3.5. So it's highly acidic to be able to break down things like protein, to be able to emulsify fat. So it really needs to be that acidic. Pro tip here, have access to a Kangen water machine and you get some of the 2.5 water. Really good if you need more stomach acid. Naturally, there's ways to test if you need additional stomach acid, which we'll get into in Intro to Holistic Medicine 2. And so take a look at that if you're interested. And so when we look at the stomach and the stomach pH levels, it has to be that highly acidic to emulsify, but it's not the only thing. We also have our small intestines for absorption. And so that needs to be more in an alkaline state for more enzymatic function. So that's why it's preferred to do more of an alkaline diet. When we take our pH levels, if they're way too acidic, so a lot of times people will first take them and they're in the 5s, they're in the low 6s. And so that is too acidic for our mouth, because our mouth actually needs to be alkaline and match our small intestines. So we take our numbers, and then what we want to do is build up to 6.8. How do we do that, right? How do we do that quickly? Changing our diet. So we need more of an alkaline diet, which means we need less of a processed foods diet, less of a sugar diet, a high fat diet, all of those types of foods that are part of that standard American diet we want to reduce. It's easier, instead of going, I need to take these out, rather we want to add the alkaline in. So as we add alkaline, we add things like ginger tea, we add things like leafy greens, we add things like leafy green powders, like think wheatgrass, think chlorella, spirulina. And in fact, I would like to use those powders to kind of quickly, get the alkaline state up. So you can do that pretty quickly if you stay disciplined and if you stay focused. So we'll talk more about habits and habit formation. Lastly, that large intestine needs to be about 5.5 to 7.5. So 7.0. So a little more on that acidic side than, let's say, your small intestines, but it's because it regulates all that gut bacteria. And according to Harvard Medical School, digestive imbalances actually contribute to 80 to 90% of chronic diseases. And so we know that metabolic health is number one and really is the basis for all disease, right? It doesn't matter what it is, there's breakdowns in the metabolism, which is nothing more than breakdowns of nutrient deficiencies and accumulation of toxins. So we're focused on digestion with our salivary, right? And then we're looking at urinary, which is our toxicity. So if your pH level is off, right? If your salivary is off, you're going to have digestive issues, acid reflux, bloating, indigestion, possibly, right? And then if your urinary pH is too acidic, so again, we want to keep more of that 6.8 to 7.2, even higher a little bit with your urine. That helps us to see how your kidneys are detoxifying. So we look at, how you are, handling that toxic buildup. So if that number comes out really acidic, what we want to do is we want to add antioxidants. So berries, blueberries, things like that. But also you can begin biohack the body using these these red powders. So red powders have high ORAC scores. So if you've seen that ORAC and there's an ORAC score, different foods have different gradients of ORAC scores. And so the higher the ORAC score, the higher the antioxidant level. There's other antioxidants that you can do too. So your network antioxidants. So what are those? Those are your really powerful antioxidants that help fight free radical damage. Vitamin C is one of them. Vitamin E is one of them. CoQ10 is one of them. Glutathione is another one, right? You can even actually use an ALA, which is an alpha lipoic acid, along with a vitamin C to recycle and open up that uptake for glutathione, which is the master antioxidant as well. And so, we want to really stimulate, all of the nutrients that we need, B complexes as well, amino acids, all help in phase 1 and phase 2 detoxification, which we'll talk a little bit more about this week. And so I want to regulate these pH levels and get them as close. So first things first is we need to be tracking them every single day. In the course shell, you will have information and a resource of how to track, best things to track, where to get pH strips. All your questions that I'm sure you're thinking about right now are all answered in the course. This is more so just an intro video about our topics for this week. I do them every week. And so, learning about your pH levels and tracking it. So we have a paper tracker, which our metabolic pH guide, as well as our digital tracker, which is through Holistic Life app. And so as we start tracking, we start to see trends. As we start looking at our diet, looking at our hydration, we further see trends to really help to support our body's ability to heal itself and look at the causative instead of just managing the bloating, the gas, the acid reflux, the inflammation, the whack-a-mole. We're going to really work on being proactive instead of reactive. So thanks for watching. I look forward to seeing you at any of our events this week with 100 Packs on Wednesday at 12 p.m. Eastern Standard Time, Thursday for our Lunch and Learn webinar. If you miss it, or if you just want to catch it, you're maybe at working or something, you can click the link below and we'll register. You can get the replay as we do it. And then Naturally Intro to Holistic Medicine will be on Wednesday at 7 p.m. and Saturday at 11. So see you all then. Enjoy.